Good morning and welcome everyone. Thank you for joining the eCongress. We recognize that we are living in unprecedented times and different circumstances, and we hope that you and your loved ones are doing well. Before we start, I am here to introduce the platform to everyone and share a few reminders. The session is accessible through our Facebook page at fb.com/telehealthpolicy and on our YouTube channel at bit.ly/capital T telehealth, capital P policy, capital Y, capital T. It is also available on Crowdcast. We would also like to recognize everyone who is joining us from each of your locations. We would like you to be part of the conversation. Your reflections and questions are very welcome. Please use the comment functions of Crowdcast, Facebook, and YouTube Live to send them so our panelists are able to respond. One final reminder is that this is an evolving process. We request everyone's patience during this time given difficulties in connecting from each of our locations. There may be a few distractions here and there, but we hope to have a smooth program flow for today's program. To start, I would like to introduce our moderators for today. Dr. Portia Fernandez Marcelo is a professor at the UP College of Medicine and leads the AHEAD Telehealth Policy Project. Ms. Charity Tan is the Chief of the Knowledge Management Division under the DOH Knowledge Management and Information Technology Service. And she is an avid supporter of everything related to CRVS. Please welcome, and I am now giving the floor to Dr. Portia and Chief Charity in a moment. Thank you.
Good afternoon, everybody. Uh, hello from the University of the Philippines, Manila. My partner in crime, Chief Cha, take it away.
Hi everybody. Hello from the Department of Health, Manila.
We can't hear you.
Oh, we can't hear you. Wala. Okay na? Okay na? Okay.
Oo, naputol.
Good morning, everybody. Thank you for taking the time to join us today as we launch an exciting series of online events, both live and recorded, to be held every Thursday. Our main focus over the next few weeks is telehealth. One way or another, it has impacted each of our lives even before COVID-19. But it has not been as widely used and accepted by physicians and patients alike before COVID-19. But it has been gaining traction since then. The New England Journal of Medicine calls telemedicine, called it virtually perfect. The Lancet says physicians have embraced it, and in the Philippines, the business of telehealth grew by 450% in April due to the pandemic. Yet, many challenges in implementation remain. Despite 15 years since it has been introduced by the government, scale and sustainability beyond pilot or small-scale implementations are yet to be demonstrated due to a myriad of human, organizational, and policy factors. However, the promise of telehealth as an enabling healthcare tool for Philippines is heightened in the light of the newly enacted Universal Healthcare Act and its surge in use and acceptance amidst the global COVID-19 pandemic. So join us today and for the next Thursdays and follow the consultations, conversations, and debate using hashtag Telehealth Thursdays. Again, that is hashtag Telehealth Thursdays, as we agree on the roadmap towards creating telehealth-enabled healthcare provider networks in the Philippines.
Yay. Thank you, Chief Charity. Again, welcome to our Telehealth Policy eCongress. We very much wish that we can be together face to face in forums like this, um, but we hope to reach more through this online telehealth consultation. So you know that the country, especially the government agencies, the University of the Philippines Manila, through the help of what is now the Communications and Information and Communications Technology Department, initiated telemedicine way back in 2004, and now fast forward 15 years later, we're discussing much more what telehealth should be in the era of universal healthcare. So this project, the Telehealth Policy Project, will not be uh, initiated if not for the collaboration, definitely, of our Department of Health as well as the Department of Science and Technology. Unfortunately, Dr. Montoya, the the executive director of PCHRD, cannot join us, but he sent a message of welcome and hello. So to our Department of Health, Undersecretary Dr. Mario Villaverde, to our DOH KMITS Director, Dr. Enrique Tayag, our UP Manila Chancellor and Executive Director of the uh, NIH, Dr. Eva Potionjo de la Paz. And for the telehealth project team, our partners from the DOH and UP Manila, and everyone else joining us from their homes, good afternoon. Congratulations to this telehealth policy project team for organizing this telehealth policy e-congress. As we protect ourselves from the risk of COVID-19 through isolation and limited physical contact, telehealth and the use of ICTs in healthcare has become more significant in our daily lives. From contact tracing, using mobile applications, to online medical consultations, the role of telehealth in providing accessible healthcare in the midst of the pandemic cannot be overemphasized. With heightened demand and acceptability among the public, the Telehealth Policy e-Congress is an excellent opportunity to forward the sustainable integration of telehealth in healthcare. Beyond COVID-19 response, its strength can also be instrumental in achieving universal healthcare for all. Through month-long weekly sessions, I hope we initiate constructive discussions between the stakeholders on how we can implement telehealth within the UHC vision. This way, we ensure that telehealth addresses the healthcare needs of our communities and assists our healthcare providers, in the performance of their duties. As our partner in this advocacy, the Department of Science and Technology, the Philippine Council for Health Research and Development, PCHRD, thanked the head HPSR telehealth project team for your hard work and dedication. Through our collaboration, we foster a healthcare system that will make Filipino lives better. May we always champion telehealth for equitable, accessible, and affordable healthcare for all Filipinos. We see you in the coming Telehealth Thursdays. Maraming salamat po. This message is from Dr. Jimmy Montoya, the Executive Director of PCHRD. Clap, 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 clap. Thanks, everyone. Dr. Montoya and the PCHRD and DOS is definitely our ally in all of these R&D and innovations as we try to strengthen our health systems. And I am sure he is also calling for younger innovators to come on board to really heighten and work with us in improving our health system to make it really more responsive. Okay. Chief Charity, may I call on you?
Okay, so thank you for that, Doc Portia. Our keynote speaker is a current undersecretary at the Department of Health and heads the Health Policy and Systems Development Team. He received his medical degree from University of Santo Tomas. His MPH at the University of Philippines, Manila, and Masters in Public Management under a joint program of the National University of Singapore and Kennedy School of Government, Harvard University. Currently, he also teaches public policy and health governance at the Ateneo de Manila University School of Government. He is immersed in various consultancy work related to public management and health. He spearheaded several researches on health sector performance and on local governance and service delivery. So everybody, please let us welcome Undersecretary Dr. Mario Villaverde. Sir.
Thank you. Ay, paano? Naririnig na?
Yes, we can hear you.
Thank you, Charity and Portia. At magandang umaga po sa inyong lahat. First of all, let me express our gratitude for your presence in this event. And I would also like to greet Dr. Menchit Padilla, Dr. Jimmy Montoya, for being partners in this particular video conferencing. And of course, Dr. Eric Tayag and our resource persons, Governor Danilo Suarez, my governor, I'm from Quezon, and of course, Dr. Grace Santiago, the Provincial Health Officer. Hindi ko pa namimit si Dr. Santiago. And of course, Mayor Lino Cayetano and Dr. Norin Osano, whom I have met previously during our polio campaign, no? Naka-assign ako sa Taguig, so I have been meeting with them several times, no? But this day marks the start of our consultative events for the Department of Health's research project under the program AHEAD HPSR. So again, welcome to all of you here, and as you all know, AHEAD HPSR program is the DOH's mechanism for funding research with the end in view of generating sound and robust evidence for use in policy development and the decision-making process. Now, this affirms our aspiration for a culture of evidence generation and use for improved health status, productivity, and the quality of life of the Filipino people. Now, today, we will be taking up a priority and timely initiative that really needs evidence, that is telehealth. While DOH has funded 3 telehealth studies in 2018, and another one is currently in the pipeline. So telehealth and all its variations, no, in terms of terminology, mayroong digital health, e-health, and so on, no? All of these actually now are enshrined in the Universal Healthcare Act, or the UHC Act, or Republic Act 11223, no? But the term that they use there is remote health packages, no? This is an innovative and cost-efficient, sustainable intervention that will improve our health service delivery, no, in province-wide and city-wide healthcare systems. So a telehealth initiative that has been started is the telemedicine. It has enabled individuals or patients to receive primary healthcare services in the comfort of their respective homes. Such a scheme, at least in its area of implementation, had decongested our health facilities of non-emergency and non-life-threatening and of late non-COVID-19 cases. Also, through telemedicine consultations, patients have been properly referred to the appropriate health services as needed. Evidence that can be generated from the continued implementation of telemedicine can greatly contribute to the operationalization of the province-wide and the city-wide healthcare systems, especially in providing healthcare services to geographically isolated and disadvantaged areas or GIDAs. In its early phase of development, I actually have observed this. When I visited Bukidnon, I think one of the district hospitals that is, I think, in Valencia, and there was this high-risk pregnancy, no? And the one manning the district hospital is a general practitioner, but he needs to consult a medical specialist, specifically an obstetrician. And I've seen this through some form of telehealth or telemedicine. He was hooked to the Northern Mindanao Medical Center, and the expert in the Northern Mindanao Medical Center in Cagayan de Oro is actually instructing him on what procedures will be done, parang bedside discussion, you know, and I think that this is a very good innovation at that time, no? I think more than 10 or 15 years ago, no? And I think that this should be further developed. And I think now, after a decade, no, or more than a decade, it has gone through several processes of acceptance as well as more innovation that is happening in this field. So, in effect, better equity in health can be achieved, no, sooner than expected with this technology. And from an administrative perspective, no, telehealth, specifically its electronic health information systems, provides an efficient platform for the collection and submission of health data, as well as critical health reports from public health authorities in the localities. I think that this is another major use. You know? I have seen this naman demonstrated to me in the early 2000s when I was doing my second masteral in Singapore, and they have shown me how patients are not bringing their records from one referral to the next referral level of facilities, because the next referral facility can avail of the records as well as all the laboratory results and procedures that have been done to the patient through electronic means. No? And now that we are entering into this technology, I think we can better make use of this. So as an initiative to make healthcare accessible to the public during, especially this time of community quarantines, no? We have partnered with private institutions capable of providing free healthcare services via telehealth to everyone, everywhere. So this has led to increased uptake of telehealth services among the population, ensuring access to safe and quality healthcare while staying apart. So telehealth also promoted digital contact tracing, which enabled early case detection for reduced viral transmission. No? So this is really very timely in this time of COVID-19. So under the new normal and in the light of the universal healthcare implementation, the DOH is motivated to pursue telehealth. In fact, this should be now developed as a package of healthcare service within PhilHealth, no? So that those providing telehealth services will also have some remuneration, no, related to the services that were done through telehealth. Thus, it is incumbent upon us to take steps in ensuring the sustainability of telehealth. Telehealth is here to stay. It is high time to intensify work in telehealth so we can reap monumental dividends from such undertaking as soon as possible. So the consultative events that will commence after this launching will serve as venues for gathering insights that would redound to improve healthcare systems. There will be panel discussions and open fora over the next few weeks to jointly craft the telehealth implementation roadmap and its regulation. Now, just to entice KMITS together with PhilHealth, no, you should already sit down to develop the package, no, of health services that can be delivered through telehealth, and of course the cost of such package, no, so that this will change the behavior of most of our service providers to shift to some form of telehealth, particularly in areas, no, where this can easily be done right now with the new normal. So again, welcome to this Telehealth Policy eCongress. Your inputs and experiences will be the building blocks of this endeavor. Let us maximize the use of available communication technologies under the new normal in realizing our objectives. So we hope to see all of you over the next few weeks. Maraming salamat po at mabuhay tayong lahat.
Okay. Thank you very much.
Thank you for that, Yusek. Actually, we have already started sitting down and discussing the telemedicine with the benefit section of PhilHealth. So thank you for that again. So our next,
Yeah, although they are under attack, particularly the IT system of PhilHealth is under attack.
yes, but surely there should be okay. So our next speaker he is currently the director of the DOH Knowledge Management and Information Technology Service. He provides overall direction for sector-wide information communication technologies services towards better health outcomes through evidence-informed decision-making at all levels of healthcare. He is also more popularly known as the Dancing Doctor, and currently he is the one pushing for telemedicine during this time of COVID-19 pandemic. So let us all welcome Dr. Enrique A. Taya.
Thank you, Charity. Good morning, everyone. Good morning, Portia, for being moderators to this Congress initial session. And I'd like to also greet Undersecretary Mario Villaverde and earlier Dr. Jimmy Montoya. Although he was not with us, he was able to share his message from Dr. Eva de la Paz. Maybe later we can hear from her from the UP Manila. And of course, Governor Suarez, I hope he can join. And the Provincial Health Officer of Quezon, Dr. Grace Santiago, an acquaintance, a personal acquaintance of, and Mayor Lino Cayetano and his City Health Officer Oseno from Taguig. Good morning, everyone. Okay, I hope you are all healthy. If not, then consider telemedicine. Maybe it's for you. Okay, can we share the screen now, please? Can we share this screen?
Hello, Dr. Dayag. Yes po, if you hover doon po sa taas, may icon po na share screen.
Okay.
Right, upper right. Upper right, Dr. Taya.
Uh, yeah. Aliyah, can you do it instead? Wait.
Hello, can you share? Are you seeing our screen now?
Can you
Sorry,
show it,
hindi pa po,
Aliyah?
ma'am.
Not yet.
Should be
Yes.
seeing our screen
Yeah,
now.
perfect.
Not yet.
All set. All set. Thank you.
Okay, we have the screen. I'm sorry.
Uh, sure, we see your screen already. The DOH
Okay.
telemedicine sound box.
Okay. Thank
Yeah.
you, Portia. Okay. Uh, as a response to the COVID-19 pandemic, several public health measures were actually initiated based on science or what we know now of the natural history of the disease COVID-19. It also was based on the health system capacity and existing technology. The main goal was to save lives, flatten the curve, which meant fewer cases get sick at the same time, and the health system is not overwhelmed at the same time. Today, we're going to have a quick dive on telemedicine and how it has fared in our COVID 19 response. Next, please. We want to share with you, for example, the potential role of telemedicine in COVID 19 response and for our future endeavors in delivering healthcare services under the Universal Healthcare Act, our actual experience with it, and how we can make it better. Next slide, please. Okay. In this slide, we show you the prevention and control continuum when we address the gaps or as the amalgamation of our response to the COVID 19 pandemic. We have, for example, to prevent and control the pandemic. Prevention required health promotion and health education with repeated incursions that result in acceptable behavior, as in proper timing of wearing masks. Control requires early detection of contacts and cases and their subsequent quarantine and isolation and treatment, respectively. Potentially, telemedicine as a technology can actually be supportive from anywhere from this one mark to number 10. And altogether, telemedicine has the potential to address the gaps in implementing these measures. Next slide, please. The DOH COVID 19 hotline 1555 was created to essentially address the increasing demand for health information. That's how we started. I received instructions from Secretary Duque III to immediately convene a group of 40 call center agents, and we did not have that number at the start of the pandemic. So, what are we to do? Now, this platform, this hotline was very important thing because we want to provide health information, not fake news, as fast as we can to the most number of people, especially when there was a complete lockdown when people were urged to stay home. The telemedicine platform was integrated in the hotline later. Imagine me speaking to you now, but through telephony, was a call center agent, a health provider, a telemedicine provider for countless number of calls at that time when we introduced it as 1555 in cooperation with the Department of Interior and Local Government. We give thanks to the call center agents and to Smart PLDT, which allowed us to use their platform. The teleconsultations were done by volunteers, initially from some from the Philippine Society for Microbiology Infectious Diseases. Yes, we had specialists. And so from my alma mater, the UARM, Memorial Medical Center, the Philippine College of Physicians. We had so many volunteers so that we were able to allocate the time with us on a 24/7 basis. Imagine that. Next, please. Now, this would not have been possible if we did not work with multiple partners. So these partners were essential. Aside from that, we had to issue relevant policies so that we can have the standards in place that can guide our decision makers and even the implementers. We want to make sure even those in the industry will have to follow these specific standards so that there will be no confusion at all on how it is being implemented. Next slide, please. Here, we show you telemedicine's first principles. We understand that so many Filipinos have access on many gadgets for getting access their online information and even services such as telemedicine. Now, when we delve into this telemedicine, we wanted to make sure that it is inclusive. No one is left behind. The Department of Health stands by its decision that when proposals for IT solutions are actually sent to us or provided to us, one of the first thing we look at is if it's going to have an imprint on equality or equity. Guaranteeing equal access is paramount. Then we worry about privacy and data usage concerns. That's why we have to work with the DICT and the National Privacy Commission as we make assessments of telemedicine applications, and including our own hotline telemedicine platform. And then we have to adopt a science-based, which is transparent and which can be audited, algorithms that allow telemedicine providers and even call center agents to walk through the processes involved so that we're able to answer queries and provide process flows that are based on science and the base evidence that we have. We also consider digital deployment strategies. Let's say, for example, for healthcare workers, as a matter of our thank you for them being our heroes as frontliners. And of course, we only proceed on the basis of individual consent. When you call 1555, for example, we automatically actually getting your individual consent. Next slide, please. Okay. Here are the metrics on how we fared. For example, from March to June 2020, at least telemedicine partners were engaged. That's the Consulta MD from Globe and Telemed. And of course, we have three more. One of them is CU Doc. And we were able to actually source from in-house hiring and from DOH volunteers. And as I mentioned, from the private sector. And what have we accomplished? More than 50,000 telemedicine consultations between April 7 to June 1, as reflected in this slide. And it resulted in the utilization of up to 45 or even more doctors per day. And while we started with COVID-19 teleconsultations, it actually scaled up to include even primary care services, the non-COVID-19 consultations. Next, please. Of course, we have to monitor demand, find out the satisfaction of those who use the telemedicine services, and we have to also monitor data privacy breaches. And we are so satisfied that we're able to achieve zero data privacy breaches. We had very high ratings from our clients, despite the fact that when we monitor the calls in the hotline, there's a long queue, there were dropped calls. We want to thank those who actually made their calls, stayed on the line with their patients. They understood that there were so many calls and they each will have their turn, and that they'll be provided the informational services that they really need. Next slide, please. In this slide, we show you a list of some of the critical success factors we have to consider based on our experience and which may actually influence the future viability of telemedicine as an alternative option in the delivery of health services. We encourage you to start your own telemedicine. We have the guidelines, we have the policies how to monitor success. But this list should be very important to you for those of you who will be engaging us so that you will have this platform on telemedicine. For example, the access of patients through ICT is a driver of telemedicine. Right now, telephony is the primary means of communication, but later, Dr. Santiago will be a witness of how we actually started telemedicine in Quezon using sophisticated equipment. Yes, it doesn't have to be telephony. We are, for example, having a collaboration with the Quezon City government with a virtual telemedicine platform. The regulation is an enabler to increase telemedicine providers. So we had to make sure that our lawmakers will provide us an enabling laws so that we can realize actual regulation. The type of financing can shape cost-effective provision of telemedicine. We are now in talks with Philippine Health, the PhilHealth Corporation, despite their situation now, so that the reimbursement can actually be integrated into our telemedicine services. And the opportunity to make sure that we scale up telemedicine in terms of privacy standards, multi-agency accountability is a work in progress. And we want to thank, for example, the UP National Telehealth Center, all our partners, even the private sector, the DICT, the OST, for making this possible. Next slide, please. It is also important to consider the following when we assess and evaluate the contribution of telemedicine as a response to COVID-19. So, has it helped in controlling this transmission? How has it figured out in detecting, testing, tracing, isolating, and treating every case? Can telemedicine actually contribute by identifying the hotspots? How about schools, workplaces, and other essential places? What can telemedicine provide? Can we manage importation of new cases with telemedicine? How about communities that are fully informed, engaged, empowered, so that individuals will maintain correct behaviors? And establishing telemedicine in LGUs, we are going to do that. And for the information of everyone, we have hotlines in the National Capital Region and in Cebu City. We are currently working with the Cebu Institute of Medicine and other institutions, and we'd like to thank there are volunteers there for making sure that telemedicine will answer the gaps in the disruption of services when they have their lockdowns. And the last slide, please. Why not call us at 1555 and have a taste? Thank you so much. Good morning.
Clap, 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 clap.
Thank you, Portia.
Thank you, Dr. Tayag. That's exciting. So, from our incipient stages of telemedicine, well, in a way, we're thankful for the pandemic because people started really considering all of these. And to our audience from many parts, from Cagayan Valley to Misamis Oriental to Batangas, thank you very much for coming in. So, we're all excited to see precisely how telehealth has permeated more of the Filipino healthcare institutions. So schools are coming on board. So we really just have to, fix more of these things to be put in place so that we can really answer the questions that our Dr. Tayag just raised. So those are,
Portia,
yes, sir.
Portia, if
Okay
I
po.
could share, yeah, we were inspired by your RX box. You were the pioneer.
Yes,
Okay?
sir.
Say this again. Was
Yay,
an
clap, clap, clap.
inspiration, yeah. We just the COVID-19 pandemic was just a silver lining, and
Yeah.
we have these different platforms. Thank you so much.
Yes. And precisely, maybe that's also to highlight the roles of the academe and the university and research institutions. So, in looking for new solutions, and precisely why DOS is also part of our team in looking for all of these changes. So to talk on behalf, to welcome you and to have a message on behalf of the University of the Philippines, Manila, please welcome geneticist par excellence who trained all over the world. Pero ganun siya ka-nationalist. That's why she came home. Please welcome my boss, the ever beautiful Dr. Eva Maria Cotionco de la Paz, NIH Director. Thank you.
Maraming salamat, Dr. Portia. Magandang tanghali po sa inyong lahat. Lubos pong kinalulungkot ng aming Chancellor, si Chancellor Carmencita Padilla, na hindi niya kayo makakapiling para sa napaka-importanting pagpupulong na ito. Siya po ay nasa Presidential Advisory Committee meeting po ng UP. Allow me to read her message to all of you. I cordially welcome all the different stakeholders represented here: patient groups, healthcare workers, local government units at the forefront of UHC implementation, telehealth providers, finance groups, and the academe. Magandang tanghali, Department of Health Undersecretary Dr. Mario Villaverde of the Health Policy and Systems Development. Magandang tanghali rin kay DOH Director Dr. Eric Tayag ng KMITS. Magandang tanghali din po kay Health Officer Dr. Osano of the Citywide Telemedicine for COVID of the Quezon Province, Provincial Health Officer also of Dr. Grace Domingo, who initiated the province-wide telemedicine 2018. For Quezon Province, Dr. Osano was for Taguig. Dr. Charity Tan and Dr. Portia Marcelo, the lead organizers of this Congress. Thank you for this opportunity to share a few words during the launching of the Telehealth Policy eCongress. This conference will highlight the integration of telehealth into our health system, which now becomes necessary because of the two major developments affecting healthcare delivery: the Universal Healthcare Act and the COVID-19 pandemic. I would like to congratulate the Department of Health, the Department of Science and Technology Philippine Council for Health Research and Development, and the UP Manila National Institutes of Health as they jointly launched this Telehealth Policy eCongress. Since 2004, the National Telehealth Center one of the institutes under the UP Manila NIH, with its pool of experts in different health professions, has been providing innovative solutions in support of our healthcare system. The National Telehealth Service Program allowed UPPGH medical experts to support clinical decisions of over 1,000 doctors to the barrios and municipal health officers serving rural, remote, and disadvantaged areas. The initiative spearheaded regionalization of telemedicine. Experts from East Visayas and Baguio General Hospital came on board to support their own regions. The center has also developed the RX Box telemedicine service or device, the CHITS electronic medical record system, and the NTS telemedicine platform, linking this in a seamless manner. The first to demonstrate standards based, digitally interoperable systems. Efforts to make healthcare more accessible and efficient for our citizens. The Medical Teleparasitology Project allowed medical technologists of the Cordilleras and Davao region to telerefer difficult cases to parasitology in Quezon City, to parasitology experts from the UP College of Public Health. The citywide implementation of CHITS in Quezon City digitized all its government primary healthcare centers and then linked this to the City General Hospital and the DOH Quirino Memorial Hospital through the MINTS Mag-ina telereferral system, became the first electronic health service delivery network for maternal and child health in the country. Likewise, the telehealth project of the Center with the National Ear Institute also demonstrated a telehealth enabled newborn hearing screening referral system and electronic service delivery network for hearing impaired children in the Visayas, this time involving both private and government health institutions. These are concrete lessons for health sector reforms, for digitized and more caring healthcare provider networks under the Universal Healthcare Law. These projects are in keeping with the university's mandate to keep a national leadership role in health education, research, and public service. The COVID pandemic also bolstered the hospital wide shift of the PGH to digital charts and telemedicine. With this, the PGH departments will be able to communicate with their patients through a dedicated online platform. Our UPPGH Bayanihan na COVID-19 Operations Center's hotline 155-200 with phone lines donated by PLDT was set up by the university IT team. Other projects include the UP Philippine Health Insurance Corporation webinar series on Stop COVID Deaths, available periodically through its own dedicated Facebook page. The best practices of clinicians, hospital administrators, and other healthcare workers throughout the country in managing COVID 19 cases are widely shared through this platform. All of these were made possible with the support of many institutions and policies that enabled us to put them in practice. With the full implementation of the Universal Healthcare Act, the National Telehealth Implementation Roadmap and Regulatory Framework is seen to be the needed guide to ensure full and safe integration of telehealth and digital systems in a more responsive Philippine healthcare system. This roadmap is proposed to the national government, but true to the spirit of the universal healthcare, we need to hold this series of dialogues with different stakeholders and bring your voices into policy making. Thus, this Telehealth Policy e-Congress will be held across 5 succeeding Thursdays beginning today. Please join us in all the discussions. To reiterate, UP's public service role, we remain committed to serving the people and the nation as a partner of the Department of Science and Technology in innovations and research, as a partner of local governments and the Department of Health in the UHC implementation, and in our current fight against COVID 19. UP remains a committed partner towards achieving health equity. To complement the telemedicine efforts, UP Manila has just created the UP Manila Telehealth Committee to prepare practice guidelines for telenursing, teledentistry, telepharmacy, teletherapy, and many more. Aking dasal ang tagumpay ng napakahalagang proyektong ito. Kapit bisig tayong lahat at maaalpasan pa natin ang COVID-19 papuntang mas maaliwalas na kinabukasan. Maraming salamat po at magandang hapon po sa inyong lahat.
Okay. Thank you, Boss Eva. Thank you, Dr. Eva Maria Cotillon de la Paz from the UP Manila. And we really look forward to the strong involvement of the universities, not only here at in Manila, but all across the country, because the work is huge. And I hope you took inspiration also with the work of the NIH in many of these things. And this COVID, we also want to thank Dr. Eva, because she's been tirelessly working to make sure that the NIH lab is working for the COVID testing. Yeah. So thank you again. And true to form, the university actually, yes, ma'am? So tama-tama, from the university, we cannot do our work if not for local partners. So we segue now to best practices in telehealth now, implemented citywide and province-wide. I will first call yung kapitbahay natin yan, dito sa Maynila. Okay, hindi pala. Lalayo muna kami. So tatawagin ko muna ang aking partner, Charity. Please introduce our partner from also in Luzon. Go ahead.
Okay, today we are privileged to be joined by two champions of telehealth. First to speak is the mayor of Taguig City and the current head of the Taguig City Health Office. Mayor Lino Cayetano has been serving the city of Taguig since 2019. He was a former congressman representing Taguig 2nd District. With him is Dr. Norina Osano, who is currently the City Health Officer. During the COVID-19 pandemic, Mayor Cayetano led the implementation of its own telemedicine program so the residents would no longer need to go to hospitals or health centers for consults. Covered by 31 health centers and 3 super health centers in full operation, residents can seek medical assistance from their homes and receive medicines at their doorsteps. So please, everybody, let us all welcome Mayor Lino Cayetano of Taguig and Dr. Osana.
Osano.
Sorry,
Osano. Dr. Osano po.
So thank you very much, Dr. Osano.
Dr. Osano, yes.
Hello.
Dr. Osano.
Good afternoon, everyone. First of all, we would like to thank the organizers of this Telehealth eCongress for taking Taguig as one of the presenter for this launching. As we know, in the early of December 2019, when this new virus, the coronavirus, then named COVID-19, our city had been in preparation of this new virus. Come March, there was local transmission which was reported. Taguig is in the first city that was reported. So what our city, headed by our Honorable Mayor Cantano, has several meetings and planning with our SEDSU and City Health Office on the program of telemedicine. Come March 2020, when the President Duterte had announced for the ECQ, our city had been prepared on the telemedicine. Yes, we have 31 health centers and 3 super centers. Each were provided with the service phones with the respective telemedicine numbers. These numbers are posted in our social media, our Love Tagig page, then also at the barangay, at the health centers. All the constituents will just uh, call or text, then at the health center or our health facility. One service phone will be received through text by our PCR or this patient um, representative, then it will be logged in or be noted. The number will be also noted. It will be given to the doctor. Of if on call, the doctor, physician, the health center physician will gladly receive it. Then consultation and assessment is done right out. The medicine or the will be prepared because medicines are given for free. It is door-to-door delivery to the respective community. As of March to present, we have the data showed on our telemedicine. For the population of Taguig, we have around 86,474. We have service and telemedicine consultation of around 81,719. These are all, it comes in medical consultations, for referrals, for the delivery of other medicines, for the, as we know, our objective is not to continue the primary health care at the community level during the ACQ. So all the communities will just do is to text or call, then medicines are delivered right out at their doorsteps. If not available, the Hatid Sundo is also done at our city. If indeed to be checked up personally by a health physician for assessment, they will be picked up at their house, then brought to the health facility. If laboratory is also to be done by requested by the health center physician, then laboratory is done at our facility. For our COVID hotlines, we have our numbers also. Referrals is directed to per health facility or barangay. We have our BHERT. So coordination between the COVID hotline and the health center physician ng barangay is properly in place. As we all know, telemedicine was put in place by our city for the protection of our community as well as for our frontliners. We didn't stop there. Health facility is given. We continue on our DOH program, from the TB program, family planning, Menchan, for the NIP. It still continue. All they have to do is inform the health facility on the schedule of immunization, for the FP commodities to be delivered at home, for the NCD, the maintenance medicine was also delivered at home. So this, in time of that COVID pandemic, the constituents have got the satisfaction from the telemedicine. At first, it was hard for us because the use of the service phones, we have many patients calling in and text, so it take time. Pero that day by day, we're learning it. So our health center physician had been adjusted, and telemedicine, as shown by our data that they have served the community here in Taguig. Other wealth, because on the time of the administration of our city mayor, he has goals and vision for Taguig. That is the 10-point agenda. So, three have been entered in our goals. That is for a healthy city for Taguig. a safe city also for Taguig and caring community. So this telemedicine had been a great help, give satisfaction to our constituents, and hopefully, even in after pandemic, the telemedicine will be with us. Telemedicine had been supported by our LCE, the our local government executive, um, with giving free loads. The SIM cards are provided in their service phones. All this have to do is to be used up for our telemedicine. Furthermore, uh, we still continue our regular services on the DOH program at the health facility through this telemedicine. Even in the private sectors, they had volunteers on the time of ECQ. We have telemedicine by specialty. Uh, the pedia, the OB, for mental health, we have for IM, even our veterinary medicine. We have posted, and I love to give these numbers, the days and time available. All the all you have to do is just call or text through this the numbers posted at our I love page Taguig. Other more for our, so we want this to, what is the management? Just as I say, the service phones is given to the 31 health centers. Then they just have to use the call and text. The SIM cards and the loads are free for the use of the health centers. Medicines are delivered door to door. Our BHW, we have the greatest number of BHW. We have 858. These BHW are used up by our city for the delivery of medicine at the doorsteps of our constituents. Though they are also observing the health precautions, social distancing, the regular hand washing with a face mask, and even now the use of a face shields. Mm. Um, Through this our experiences, if there will be easily transition, yes, we agree to this. Just in a new norm, uh, we know also as well the benefits of this telemedicine. For those who have no transportation, there's a lack of mobility, telemedicine is a great help. Also for those mother or families who are in work, they will just have to call the telemedicine. Then consultations will be done, or any queries or referrals is also done through phone or text. Less in time in queuing when we say at the, just like on a regular basis before, when they have to come personally to the health facility. And for a better outcome for the monitoring and status of our patients, telemedicine is of great benefits also. That's all for what we have done ang Taguig.
Wow! Clap, clap, clap! Dr. Rosano and Taguig, mabuhay kayo. Ang dami pong examples and best practices. We're so excited. And maybe it's really proof that our local governments have been really working very, very hard, much more so in this, COVID pandemic situation. We are excited about that.
We
So,
just have to thank our
Especially
mayor.
yung 81,000.
oo, grabe,
Talo
51.
yung 52K ng DOH, but that 52K, hanggang June pa lang yun.
Oh, very
We have
good.
our mayor to thank you, the over-supportive mayor,
Yes.
Cayetano.
Yes. So at least we can see here the synergy definitely of local government, local chief executive supporting our health workers, the city health office, really down to the barangay. So punta naman po tayo sa kanayunan, di ba? So from a city and urban model, we will now go to another telehealth best practice from the rural communities. So our last but not the least speaker for this afternoon is the current head of the Integrated Provincial Health Office of Quezon province. Together with Governor Danilo Suarez, she has been leading efforts in the pandemic as well. In 2019, however, they really pioneered in the sense that they implemented and embraced telehealth uh, province-wide, um, down to the most remote areas of the province. So Dr. Our speaker later on will really share more about what they did. But please welcome Dr. Grace Santiago, the Provincial Health Officer of Quezon Province.
Thank you po. Good afternoon, everybody. And first and foremost, thank you for inviting us, Quezon Province, to share with you the experience in our province regarding the telehealth or the telemedicine. Good afternoon also to the partners of this eCongress, Department of Health, USEC Villaverde, Dr. Eric Tayag, a personal friend of mine, and of course, our host for today. In Quezon Province, we started telemedicine in 2018. The fourth quarter of 2018, we were introduced to the AMD telemedicine equipment. It's a US company. And from there, our governor, now congressman of 2nd District, was very impressed with its capability to diagnose and assess a patient. So it's the telemedicine equipment of AMD. So we purchased three of this equipment, and we had our launching in February of 2019. From then on, the three telemedicine equipments were deployed in far-flung municipalities. So since the province owns the hospitals, they were basically housed in our municipal and district hospitals. So why did we purchase this? Because we are one of the largest provinces. We have 39 towns and 2 cities, and we are basically agriculture, and we only have one highly urbanized city wherein all of the doctors and specialists have their clinics. And to get to the farthest barangay or Argida, it would take you a day and even 8 hours as the farthest to travel by boat just to reach our farthest barangay. So you would see the difficulty of accessing our health services. So this telemedicine equipment were placed in areas wherein our specialists cannot reach them. And these hospitals can only be managed by our general practitioners. As we all know, most specialists will not have the time and capacity to travel to these far-flung areas. Hence, we did provide for the telemedicine equipment. Initially, we used it for our Quezon's First 1,000 Days of Life program, wherein our beneficiaries are the pregnant moms and our babies, 0 to 2 years old. So our specialists that we have in our roster are pediatricians and obstetricians. And from then, they don't need to go to our provincial hospital, which is in Lucena City. That would take them around 4 or 5 hours of travel, especially for the consultation of our high risk pregnancies or for our babies having just simple maladies. So, what we did is that every week there is a schedule of a pediatrician and obstetrician that would go to their clinics and then spare a bit of their time, about an hour or two, to be there. And then our hospitals at the distant levels are ready now to accept their patients. So these patients have been briefed that they should be seen by a specialist. And from then on, from March until December of 2019, we have reduced our outpatient consultation at our provincial hospital by 20 to 30%. Of course, there were challenges, number one of which is the internet connection. Since this is a far-flung area, internet connection is hard to come by. So that's why we have invested in strong connections. But apparently, some of the networks are still not available in these areas. But when COVID-19, the pandemic, came about, I have to pull out the three medical equipments and place them in rural health units and in our COVID facility. Why? Because our OPDs have been closed, medical clinics have been closed. And so I also requested and tapped the Quezon Medical Society for volunteer specialists. So right now we are catering to both COVID and non-COVID patients. Our non-COVID telemedicine equipment are located in rural health units in the first, second, and third district. And the telemedicine at the COVID facility at the Quezon Medical Center, our provincial hospital, wherein our consultants did not go and see our face to face our patients. Our telemedicine equipment has its attachments, special attachments that even the doctor from the other end can advise the nurse or those general practitioners at the other end to do ECG, to do ultrasound, and of course, it also has its own ophthalmoscope and otoscope. That's why it's easier for the doctor to give medications, to do diagnosis at a very far, even though they are not seeing the patient from a near clinic, but rather just face to face on their telemedicine equipment. Um, from our data gathered, I have given one of my medical specialists this assignment, and from her report, she said most of our clients on the non-COVID area are from the ENT. So we have been catering to ENT patients at around 10 patients in a day. And of course, our high risk obstetrical patients also at 15 in a day. So they don't have to go to our hospitals or to their clinics. Also, recently, we have a plan on putting up a call center. We will be housing our medical specialists in one area, and they will be given one laptop each with a very high connectivity, wherein they can have schedule for consultation. And we are really proud that our consultants are doing this for free. But hopefully, with this KMIT's research, we will be able also to uh, probably give our doctors a certificate just to make them qualified to be telemedicine doctors. And of course, at the same time, for them to be compensated even though their clinics are closed and are just doing it through our call centers and using our telemedicine equipment. So, so far, our plans for our telemedicine is to purchase more so we can place it not only in our hospitals, but also in our rural health units. So to date, we have 15 district hospitals and one provincial hospital. So we are planning on buying 12 more units for our district hospitals and probably advocate to our local chief executives to do the same by buying one for their rural health units. So for us, telemedicine is a really helpful tool, especially during this COVID pandemic. So that's all po. Magandang hapon po.
Clap, 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 clap. Napaka-exciting naman po. We were just in Quezon a few years before all of these telemedicine initiatives, Doktora. Ang exciting naman po. And it's we also appreciate the statistics that you're showing, and you're really monitoring about all of your investments and how it's actually helping the community. So, and marami pong nagchat sa ating chat box.
Oo nga. Yes, especially I would like to give a shout out to JJ of Lalo Cagayan. So please
Yeah.
attend the session this afternoon. It's on telehealth, next generation healthcare workers, okay? Because it will provide us with a lot of inputs on telehealth. And also, uh, uh, believe din ako sa kay doktora, no, to think na yung she does not ano yun, yung internet connection na how do you call it?
Wala.
It's not a reason for her not to go into telehealth. Diba? If you will remember, si Dr. Nem Tagana, he said that if you really want to go telehealth, there are ways and means to mm, control for that bandwidth, that low bandwidth thing. Diba? And I think Quezon is a testament to that.
Okay.
Of course, it's not an issue for Taguig, who is in the seat of technology in Philippines.
No, but we're totally excited. We thank you, Dr. Ocano and Dr. Santiago, really for sharing, taking time out. And we'll have more of these. And we really hope that we can, continue having these best practices so that we can continue parang encouraging more local governments diba, how to do it and how to do it properly as well. So, marami pong mga nag-hello sa ating chat box. Thank you very much. We will no longer greet you. We've gone over time. But thank you for our discussion today. I hope everybody learned what the Department of Health initiated earlier on, our local government partners, and how our national government agencies are, working together to really, look for ways to improve things through telehealth. So please like and subscribe our Facebook page, fb.com/telehealth policy, and on your YouTube channel at bit.ly/capital T, capital P, policy, capital Y, capital T. Okay. Kailangan natin, yeah, marami po kayong mga tanong. Thank you very much. We will try to compile them and ask them in our next session. Sige. Oops, may isang tanong. Teka, kailangan daw po talaga itanong to. Could it be better if we use our own barangay health stations for telemedicine hubs rather than direct patient teleconsults? Yan, sa ating dalawang doktor na City Health and Provincial Health Officer. Pwede po bang imbes na direct patient consults,
Please
let's
repeat
use the
that.
barangay health centers? Yun na lang po ang tanong. What is your opinion on those two questions, on that question po?
For province of Quezon, may I?
Yes, ma'am. Continue.
Okay po. For Quezon Province po kasi, yes, we can utilize our barangay health stations since our telemedicine equipment is not really that hard to manage or to operate. So just a day of training of managing and using it, kaya na po itong gamitin ng ating mga nakatao sa barangay health stations, be it a midwife or a barangay health worker. So pwede naman po sila as long as they have their IT with them at the barangay level also para po alam nila on how to navigate on the equipment. Lalo na po, our equipment is with an ECG, which is Bluetooth. We have an ultrasound probe, and we have a vascular probe also. And of course, we have an HD camera wherein you can see through the ears, and then we have an ophthalmoscope. So all of this can be given to our midwives, and I'm sure they are more than willing to be trained on how to handle this. Lalo na po sa kanila ang unang bagsak ng pasyente before they can even refer it to the rural health unit or to the doctor or to the general practitioner.
Amen. Thank you. Dr. Rosano, how about that? That suggestion po.
Yeah, it could be also done at the barangay health unit, but here at the city is a health centers. So our health centers are in 8 to 5 open plus our 3 super centers. So the clients will just call or text, or if a walk-in, they could be also seen by our doctors. If we need for the referral to the nearest hospital, we have our LGU owned hospital, the Taguig Pateros District Hospitals.
Oops. Yes, thank you, Doctora. So it's quite possible, but what we are learning really is you need to reformat, restructure the healthcare system so that telehealth can actually be used. So yeah, we'll have more of that precisely. And the format of our telehealth e-congress is a panel discussion that follows parang input from our research and our consultants' work. Um, we we are winding down. Thank you for staying on board beyond our time. We'd like to acknowledge our partner, Social Watch Philippines Alternative Budget Initiative Health Cluster, the Philippine Alliance of Patient Organizations, um, the Philippine College of Surgeons, the Philippine Society of Nutritionists and Dietitians, the Nutrition Dietitian Association of the Philippines, Health XPH, CU Doc, Medify, the Luzon Crisis Assistance Team, the UP College of Medicine, MIU, Medical Informatics Unit, the Association of Philippine Medical Colleges Student Network, the Kinaadman Student Council, Brokenshire College School of Medicine, way down in Davao, the Emilio Aguinaldo College School of Medicine, the Ateneo School of Medicine and Public Health Student Council, the Bicol University College of Medicine Student Council, and definitely our DOH regional offices. Marami pa pong mga ospital na nag-sign in. We're so excited to hear from you. We also thank you for the many comments that we are no longer able to read. We will look into the options for the next session to be more inclusive, possibly including a sign language interpreter. Mr. Bernardino, thank you for that reminder. Unfortunately, we were not able to prepare for that. Um, Gusto namin din po kayong imbitahan para panuurin yung video po sa Taguig. May ginawa po sila especially for their this telehealth initiatives and the many work they are doing in Taguig. And we will be posting that in our own Facebook page. Later tonight at 5 p.m., we will premiere two of our consultants' input, three of our consultants' input. So the first is on Telehealth X Next Generation Healthcare Workers. Yan. So featured are Dr. Nemel Fahutagana, the former dean of our National Teachers Training Center for Health Professions, Dr. Harry Hamoy, our faculty in the Community Health Development Program, as well as implementers of many of our telehealth projects at the PhD. And definitely Dr. and attorney Ivy Patu, former commissioner of our Data Privacy Commission. They are our consultants. They will present to you what we have been working on and studying, and how we can help the next generation healthcare workers really be effective telehealth providers. So the second is an introduction. Okay, tama ba? So ito po ang ating mga sessions for this time. So we invite you to watch this presentation, and then please join us next Thursday to continue this conversation. And we promise to consolidate these questions so that we'll have more feedback from you and more discussions with you. Your input is very much welcome. So there are ways for you to critique the presentation so that we can incorporate it in the final paper that we will be presenting to Undersecretary Villaverde and Dr. Tayag, Director Tayag, so that they will consider it as part of national policy and the national roadmap for telehealth. I ask now Charity. That was a very fruitful 1.5 hours. Exciting. Again, Dr. Osano, Dr. Santiago, thank you very much from the corners of the Philippines. Charity?
Thank you for that. Ay, tinext ko na aking takeaway say, ICT is the driver. Okay? For this, because after all, it's telehealth. Regulation, of course, is key because we have to have regulation. Otherwise, it will go every which way but loose. And of course, financing is crucial. Sinabi kanina ni Yusek na kailangan we have to sit down with PhilHealth so that we will have, we will be sure about the sustainability of this initiative. And sinabi din ni Dr. Eric Tayag na the opportunity to expand is here and available. And with COVID-19, I think it's high time that we really go for it, for telemedicine.
Okay.
Okay.
So with that, again, we look forward to your visit to our Facebook page so that you can view our next our session, presenting to you our recommendations for how telehealth can really be sustainable. So see you later and see you next week. Thank you,
Okay, thank
everybody.
you very much. Yay!